Established on October 9, 1923, the Korle Bu Teaching Hospital has expanded from an initial 200-bed capacity to 2,000. It is currently the third largest hospital in Africa, drawing a sizable number of its clientele from Nigeria, Burkina Faso, Togo, and other parts of the sub-region.
Korle Bu's significant role it plays is a referral facility. It plays a referral facility not only for hospitals, public and private, in the Greater Accra region, but as a referral facility for the entire country. It also provides referral facilities for the African sub-region. It's important to note that we are talking about healthcare provided at the tertiary level. So all the primary clinics, hospitals at the district level, hospital at the regional level, when they have challenges in the care and management of patients, they will refer to Korle Bu.
Korle Bu gained teaching hospital status in 1962 when the University of Ghana Medical School was established for the training of medical doctors. The hospital has 17 clinical and diagnostic departments and has an average daily attendance of 1,500 outpatients and about 250 inpatient admissions. All these, coupled with the rapid, profound research and development methods adopted by the hospital, puts Korle Bu ahead of its peers in Africa.
So Korle Bu is actually at the apex of the healthcare, the curative healthcare system of this country.
The ever-growing patronage of the health facility has brought immense pressure on every facet of the hospital. This has caused rapid deterioration of the structures and equipment at the hospital. Government continues to invest significant resources to improve conditions at the hospital. However, this remains insufficient considering the enormity of the day-to-day operations of the hospital.
When we came on board in September 2014, we realized that there were a couple of things that will have to be done. And we noted money was an issue. Korle Bu was getting money from the Ghana government as well as NHIS, and we realized that sometimes the NHIS money would take forever to get in. Meanwhile, there were issues such as consumables and other things, patient care, which will have to be taken care of. The question then became, where will we get the money from? Upon further research and so on, the board came up with innovative ways where we could raise money. And one was the idea of the trust fund.
To complement government's efforts, the Korle Bu Teaching Hospital Trust Fund is primarily aimed at mobilizing resources to improve quality patient care. Projects earmarked to be undertaken by the fund include Children Emergency Ward. This involves construction of a 3-storey ultra-modern facility which will accommodate all children emergencies. The facility will have the capacity to support subspecialty services. Estimated cost for this project is $25 million.
It was realized that we didn't merely need a refurbishment because our emergency unit in particular was in a very poor state. The structure itself was noted to be developing cracks, and then the equipment there was also far less and in a poor shape. Our old emergency unit was initially designed to cater for 15 patients in the room at a time. However, there has been an increase in the number of clients that we need to attend to. So at any one time, we have between 30 to 50 patients, which means that we have to force these poor children to share beds with each other. 2 children, sometimes 3 in a bed.
Gynae complex. Currently, the gynae emergency unit where female patients are treated is a degrading structure clad with roofing sheets. This is inappropriate for the well-being and dignity of our mothers, wives, and sisters.
There is nothing good in that building. Emergency that treats women who are bleeding, in pain, and in shock are managed in such a facility which hasn't got anything to do with emergency. There are quite a number of women who come to this place daily, and the doctors and nurses have to struggle to manage them in this ramshackle building.
All cases are brought here, emergency cases from all over the country, and we lack so many things here. In fact, this place is not fit to be an emergency unit. Looking at the things that we have here, we lack so many things. The roofs are leaking, the aircon is not working well. We have about 4 beds here. That means when the 4 beds are full, the other patients who will come have to sit outside and wait for their turn.
If you go to the elective gynecology ward, there are only 32 beds. And our workload demands that we do at least 20 to 30 operations in a week for gynae electives. And we have only beds that can take only 32. It means that if the patient comes in the first 32, we cannot discharge them in the first week until beds are made available for us to continue. Then we have the gynecology theater, which has been closed for a few months now because of problems with facilities that will enable us to do proper gynecological surgery.
Architectural designs for a modern OPD to attend all female-related medical conditions have been done. The project is estimated to cost $20 million. Water reservoir. The hospital's main water source for its clinical and non-clinical activities is the Wager Headworks. Excess water is presently stored in a reservoir with a total capacity of 250,000 gallons. Unfortunately, this can only serve the hospital for 4 hours in the event of a system breakdown at the Wager Headworks.
And this facility was put up in 1953 to cater for the old hospital. Yeah, it used to be a small hospital, and this facility was put up in 1953. And the hospital is now a 2,000 bed capacity. And so this facility can no more cope with the normal of this beds and the infrastructure that has developed over the years. Now, the capacity of this facility is 1,156,000 liters. That's the capacity. But the daily consumption of the hospital is 1,750,000 liters per day. That's the daily consumption of the teaching hospital.
Management intends to raise 2 million Ghana cedis to build a 7 million litre water reservoir to ensure uninterrupted clinical works for a week when the water supply is cut from Wager. Sewerage project. Korle Bu sewer lines are over 90 years old and very weak. The sewer lines, which were first installed with asbestos, have outlived their lifespan.
For some time now, we've been having serious sewage challenges, spillage, because the sewage lines are blocked by the earth. It's crashed down because the material used previously was asbestos. So we have to excavate from Salvation. Like most of you who knows Bamprobi very well, Salvation is from the end of the road, at least to the end of the road, up to this way. It's a capital-intensive work, and this calls for the attention of the general public.
They are therefore unable to treat the hospital's waste before disposal into the Korle Lagoon. The installation of pressure lines throughout clinical areas will treat the waste we generate before final disposal into the Korle Lagoon.
Without the treatment plant, we will get nowhere because all the diseases that we are trying to treat in the hospital will be exposed to the general public.
This facility, estimated at $30 million, will provide several health and safety benefits. For instance, the possible spread of diseases through eating contaminated fish from the lagoon can be avoided. Medical OPD. Currently, a former ward, Ward K, has been rehabilitated into an OPD for the medical sub-BMC. However, the facility remains inadequate and cannot accommodate the teeming number of patients with various medical conditions.
It is important that we have a good environment to offer our patients the service. We are housed in a temporary place where we've been for the past 2 years, and the services are woefully inadequate.
The consulting rooms are also too small, implying that patients' privacy are not guaranteed. Moreover, ventilation in the unit is very poor, which is a recipe for cross-infection.
The patient complains a lot. Some say, why are we Kbth that you dry it in the sun? Others also say, when those who are climbing the stairs, the old ladies, they can't even climb. Sometimes they have to carry them.
We are so ashamed. I feel so crying. I Barbara Sana, but I have for intimate for the now. Basso come no Basano, look at you. Catch Kayaka, stand what does she? Fine. I'm going to Yakaba and Machia. Here was young fan, why in my eating, near my cock. Then I could feel Yakawato Jemo. A tower, wait, but nobody no call by chocolate for him mobile.
Mostly when there's a rainy season, nobody can sit down here. Nobody can sit down here. People will be going up and down of this and mud and all these things. And even if there's a sun, we have to shift the chairs from here to here. As you see people over sitting down here.
Hypertension is the highest cause of the reason why people come here. And most of these patients are very old. So when the OPD is on the first floor, some of them, in case the lift breaks down, it's very difficult for them to come to the top.
The hospital intends to construct a modern OPD suitable for a tertiary hospital and our patients. The project is estimated to cost $10 million.
We and our patients deserve a better outpatient unit. We are appealing to you. Please donate generously to the Korle Bu Teaching Hospital Trust Fund so that we can have a better medical outpatient unit that befits our patients.
Surgical OPD and endoscopy suite. The situation at the medical OPD is replicated at the surgical OPD. The current OPD is too small and always overcrowded during clinic days. The location of the endoscopy unit is too obscure and far removed from the surgical sub-BMC.
The work environment is really below par. The patients have a very bad experience with where they sit, starting with the patients. I mean, they are really the reason why we are here. They have to sit outside, they're exposed to the elements. When it rains, it's terrible. And we have to wheel patients across very rough corridors to be able to achieve whatever little we can achieve in these areas. And once you've gotten in, the design of the rooms are really not purpose built. This is modified areas. You cannot attract nice clientele with it's those who have nowhere else to go who come to us. People with an option will not come to us. We hope that with the support of the corporate industry we can
get an endoscopy suite as part of a much bigger facility which will serve the people of Ghana.
The hospital intends to construct an OPD with an inbuilt endoscopy unit. The project is estimated to cost $20 million. CSSD retooling. The Central Sterile Supplies Department, CSSD, sterilizes all the surgical equipment and linen used in the hospital.
At the moment, we have 4 autoclaves, but it's only one that is working. And looking at the quantum of work, the volume of work that we do, we will need at least 4 working autoclaves, functioning autoclaves, so that we'll be able to cater for all the needs of Korle Bu and the other hospitals, because they also depend upon us. But as you can see, it's only one that is working, and it has put pressure on staff working in the department, put pressure on even the people that we are rendering services to, because patients will not have their sterile needs on time.
For instance, items from the obstetrics and gynae sub-BMC may be attended to before orthopedics due to the nature of their activities. This, however, does not augur well for best clinical practices. A minimum of $500,000 is required to install autoclaves and other equipment. This will enhance the efficiency and effectiveness of the department and enable them attend to the sterilization needs of all departments concurrently.
We are appealing to all well-meaning Ghanaians who are capable of helping should come to our aid. Government is not excluded in it. As many as has Korle Bu on their hearts, they should come to our aid so that we can continue autoclaving these items of patients.
These projects are part of a comprehensive strategic plan to offer a wider spectrum of specialist care at the hospital and to position Ghana as the hub of health tourism within the West Africa sub-region.
The hospital also needs to be financially sustainable. And setting up a trust fund is a financial mechanism expected to tap into the benevolence of the people of Ghana, the benevolence of other persons who live in Ghana who may not be Ghanaians, or the benevolence of corporate bodies and corporate institutions who would want to support the care of people living in Ghana. So the trust fund is looking at establishing, like I said, a financial mechanism in which you and I can make our widow's mite contributions to be able to support the provision of care. We are looking at making sure that we are able to respond in real time with all the human resource, equipment resources, medicines and non-medical resources that we need to meet the care needs of patients.
We want people to support this fund because one thing is that Korle Bu is a tertiary institution. Korle Bu is where we train our future doctors. Korle Bu is where our specialists get trained. Korle Bu is where we have our consultants. And these hard-working medical personnel work very, very, very hard to make sure that the mission of the hospital is achieved. So, individuals will have to donate so that all these objectives, all these dreams that we have, because for one thing, we all don't know when we are going to end up in Korle Bu as individuals or our relatives or our children or our grandchildren. So if you have the best medical system, the best care, where people are motivated to provide the maximum, then when you end up here or a relative ends up here, you can be guaranteed that the best care will be given to that person.
There are multiple channels for donating to the trust fund. These include the following: project sponsorships through cash contributions into the fund and full sponsorship of any of the earmarked projects. Checks written in the name of Korle Bu Teaching Hospital Trust Fund. Pledges may also be made with specific dates of redemption. For further information, please contact Korle Bu Teaching Hospital Trust Fund Committee on 0244 406700, 0505 643244, or 0244 695388.